Good afternoon. I'd like to call the Hillsborough County Emergency Policy Group meeting to order. I hope everyone had a fantastic, fun-filled, but safe 4th of July weekend holiday. Will the clerk please call the roll?
Miller.
Here.
Overman.
Here.
Merman.
Here.
Cronister.
Here.
Caster. I'm sorry, Mayor Caster.
She's here. She's just coming in the room.
Ross.
Here.
Lott.
Kilton for Lott.
Snively.
Here.
And Weiss.
Here.
You have a quorum, sir.
Thank you. We're now moving to public comment. We'll set aside 20 minutes total for public comment. Each speaker will have 2 minutes apiece. The first speaker is Barry Jackson.
EPG, I own and manage retail shopping centers and have spent the past 4 months giving away thousands of dollars in free rent to help keep businesses open. If not for the trillions in government funding and landlords' help, most businesses would already be closed. The problem, the funding and the landlords' help was only planned for 3 to 4 months. We're now hitting the first months of businesses having to pay full rent again, and they can't. The government money has been spent, and landlords can't give away any more free rent. Businesses were just trying to hang on after reopening, and the mask mandate hit. This killed businesses again. If we don't drop the mask mandate immediately, businesses will be closing very shortly and in large numbers. We are self-destructing, not because of COVID, because of rules and mandates. The news did such a great job of instilling fear and panic, people are driving around in their cars and riding bikes with masks on. Doing my own survey, I have found that people believe that 15 to 50% have the virus and just under that have died. Both of those are less than 1%. Never by the media, EPG, or Dr. Holt has COVID ever been reported as a percentage of impact to the total population. After 4 months, the Hillsborough County impact is just now at a whopping 0.99%, and the death impact is at 0.01%. Your decisions are affecting 100% of the population, 100% of the businesses, 13% of the population is out of work. All governments are in severe financial hardship, all for something that after 4 months doesn't even have 1% of the population infected with cases, and deaths are at 1/100th of 1%. We are 3.5 more times likely to die in a car accident than by COVID, and we're not revoking driver's licenses. Political agendas need to be set aside and more time spent truly caring about the community, which includes keeping businesses open. Cases, 0.99%. Deaths, 0.01% of the Hillsborough County population. Thank you.
Kimberly Pullen.
Thank you, Mr. Chairman. As stated, my name is Kimberly Pullen, and before I begin my comments for today's meeting, I would be greatly amiss if I failed to first thank the members of the EPG for their continued work to ensure the safety and health of our community. To those of you who have supported and voted for mandating masks in our county, thank you very much. My reason for calling today is the reopening of Hillsborough County schools on August 10th. While I understand that the EPG has no authority to make decisions for the school board, you do have an obligation to protect the community as a whole. Myself, along with 2,700 other parents, teachers, caregivers, and Hillsborough County public school staff, have signed a petition requesting that the school board host a public forum for our concerns to be heard. All of the members of this group received an email this weekend outlining the specific areas that the school board has failed to publicly address, including the use of face masks. I now urge the EPG to request a formal plan from the school board to address these concerns to ensure the safety of our county beginning in August. Thank you very much.
Thank you. Jason Williams.
Good afternoon, Mr. Chairman and EPG members. My name is Jason Williams, and I live and work in Hillsborough County. Thank you for the opportunity to speak today. I'm asking the EPG today to repeal the face mask order or amend it to voluntary compliance. I've listened to every EPG call to my knowledge, and there are still statistics that have not been presented on a consistent basis. I agree with Mrs. Snively as she asked for these statistics to be reported, recovery stats, hospitalizations, death rates, etc. Additionally, Vice Mayor Ross has asked for data to help this board make logical and reasonable actions. Furthermore, this mask order is an unnecessary hurdle for business owners in our county. This makes the business owner an arm of our police, and that is unfair. The alternative is to put this on the citizen, and that would be unfair and perhaps impossible for the sheriff's department to handle. Dr. Holt has stated that there's at least a 95% recovery rate for this disease. So the statistics could be even higher, like 99%. This is an important stat, just as important, perhaps, or greater importance than the infection rates. A mandatory mask order for a 95% recovery rate. This order is ridiculous when you look at simple statistics. One of your presenters, a doctor, said that there would be dead bodies in the streets of our county. I agree with Vice Mayor Ross that that was unproductive to say and it incited fear for a virus with a 95% recovery rate. Our county workers, the politicians, professors, county doctors, and the officials of this board are still collecting a salary. Meanwhile, our businesses in our county are being devastated by this board's decisions. Today, Mr. Chairman and EPG members, this body has the opportunity to do the right thing, to repeal this face mask order or amend it to complementary compliance. Thank you, Mr. Chairman and EPG members, for your time and careful consideration.
Danielle Williams.
Hello, my name is Danielle Williams, and I am a Hillsborough City resident and employee. Thank you, Mr. Chairman and board members, for your time and careful consideration. Again, I've listened to the meetings as well, and I'm calling as a concerned citizen. These rules and intense and increased mandates, and especially the mask regulation, is choking our community. It is choking our families. It is choking our children. They cannot breathe. Everywhere we go, we are being required in a free country to wear masks. That is unacceptable. I am asking this board to please remove and repeal this undue regulations and increase control on our population in Hillsborough County. Children cannot breathe because they're being forced to wear masks. The elderly cannot breathe because they are forced to wear masks. Businesses cannot breathe because now they have people that do not want to come to their business because they have to wear masks, and then their employees have to wear masks. I've spoken to multiple people in restaurants. Their business is drastically reduced, 50 to 20%. Imagine living off of 20% of your income, while the EPG group and every Hillsborough County person currently is receiving a full salary. That is actually unacceptable. Please, if you're going to continue with these regulations, I ask as a citizen that you, in solidarity with your constituents, that you also take a 15 to 20% reduction in what you earn, so that way we are all in this together. Please remove the mask mandate. Please do not require our children, especially during the school year, to wear masks. I do not want my children to have to live a life like that. They are born in America. They were born with liberties. They were born with freedom. Please allow us to breathe. Please allow us to live our lives as God has designed us, and the freedom that we are all required and guaranteed by our Constitution. I understand your concern, but we are all responsible adults and can take care of ourselves. We can take care of our health, and we will do our best to make sure that all is well.
Thank you very much, Ms. Williams. Thank you. Thank you.
And
David Larson.
Hello, thank you for your time. I'm calling in as a resident of Hillsborough County, a small business owner. I also work 2 jobs. First, me and my wife had major schedule changes because of what happened with coronavirus. I was blessed enough to work as an essential service so that I did not get downsized or have a cut in pay. I'm pleading with you to look around and see what's in front of you and vote for a common sense solution, get rid of a mask mandate, and base something on the freedom of the American people to choose and take care of one another. Many were not as fortunate as me, and they lost their jobs. First thing you can do is see unemployment numbers. I also want to echo the free rent comment from the earlier retail owner. We do not want to depend on the government for handouts as well. We want to work off the sweat of our brow, and we want to provide for our families. I'm also a father of 5. This is affecting the people. I don't want to hear any more one-sided thing from any medical industry. I want to hear a rounded view of what is actually going on. One of my friends is in the wedding industry. They lost major business. Countless businesses are closing down. A lady who took her life savings, poured it in. After 10 years, she had to shut her gym down. Bank branches around you are closing down. Auto stores are losing customers. These are facts that I've asked people personally. Look, we don't want just Amazon to run everything and have online shopping going up exponentially. Americans should not depend on this type of situation, have to go through this type of situation. Do studies on other things in the medical field. I went to buy masks at the beginning of this coronavirus thing because I'm a woodworker. The label says they don't work. As you may know, the label changed also on Lysol bottles because I use those for my other job regarding the coronavirus. Corporations are bowing to peer pressure, and so has this county, Hillsborough, as well. Stop it. I'm pleading for a common sense approach based on the freedom of the United States of America. And I want you to shut down this EPG.
Thank you, sir.
And get back to
Thank you very much.
And put this money.
Thank you. Shannon Gilbert.
Thank you, Mr. Chairman and members of the EPG. I just want to talk about the ridiculousness of everything that we're facing and bring a few things into light. So should we all surrender our rights to driving? Not make any sense at all. Should we mandate contraceptives due to HIV virus to keep it from spreading? Should we mandate a law against gay males and have them arrested on the basis because they're at a higher risk for HIV? No, that would be ridiculous. Should we, because of politicians and city officials who overstep their bounds and the Constitution and operate as communists in direct violation of the Constitution, which they swore to uphold, should we ourselves then be forced to eliminate such positions as you hold? No, because we actually trust you and have faith in you that you would do the right thing and govern yourselves accordingly. Maybe your stance of mandating masks is because you don't trust, which may be actually reflectant of your own hearts knowing that you're not trustworthy. And maybe at this point, we should probably just mandate mastectomies and prostatectomies for everyone to keep them safe from having cancers, which by the CDC, looking at it, would be about 606,000 dead in the year of 2020, which is this year, and which no one would do because that's ridiculous, because if you're not sick, you don't need it. So if you're not sick, you shouldn't need a mask. And up to 13 million estimated in the United States in 2019 were living with a latent TB infection, and we haven't mandated masks for that. This is insanity, but we truly can't blame you. That's like blaming an infant for spitting up. No one has ever faced this. You haven't faced this prior, and it's not a hurricane, so your wisdom in this area is driven by fear and manipulation, so you need the wisdom of God actually to discern and to direct through it. So I'll pray for you that every demonic strategy comes to nothing and that you would repent and seek God rather than lying, manipulative men for answers. And Father, in the name of Jesus, I just ask that you arrest every man or woman by your spirit who is conspired behind closed doors to deceive, and let every plan be exposed. And I pray your wisdom and
Thank you, sir.
upon those who...
Thank you. Your time is up.
In Jesus' name, amen.
Megan Petty.
Yes, hi. Thank you, Mr. Chairman and members of the EPG. I am from Brandon, Florida, and I just wanted to say we have actually good news, according to the CDC. This week's COVID-related deaths are down nationwide to a minimum of 71 compared to last week, which was 313 deaths. We reached a peak back in April of over 16,000 deaths per week. And what this shows is that there is a pattern, and that pattern is proven in all virus research that once the death rate drops, we have reached HIT, or herd immunity threshold, which of course is nature's way of dealing with viruses and the most safest and effective way to overcome a virus. And we know that the viruses rise and fall in predictable patterns. And so once those death rates have plummeted, we can be confident that we have reached a herd immunity response. William Farr, who discovered that viruses have predictable patterns, stated that the death rate is a fact, And anything beyond that is just an inference. So with that said, it's time to put fear behind us and let go of the need to do what nature has already done, which is overcome this virus. And so we have actually no more need for the face covering order. So I would ask you to please take that into consideration, because according to everybody I've just heard, that has been such a problem and has not really been something that would really be effective anyway, because now nature has taken care of it and we don't have to worry anymore about this virus. We have reached the herd immunity threshold and we are safe. So thank you very much for your time and goodbye.
Jason Kimball.
Hey guys, so I'd like to talk about correcting mistakes. I think there have been some very bad, corrupt people in this group. I think there are at least 2 that we're going to need to initiate recall petitions on and pull out of office. In total, it seems there are 3 to 4 that want to shut down our county and our economy. They don't care about the health of our people and are totally indifferent to the pain and hardship imposed on businesses and residents. So guys, for the 4 of you that still have loyalty to our country and our county, we need you to be strong and vote against mandatory face coverings. Remember, there is no rational basis for these face coverings. The doctors presenting here have provided no valid evidence. When the EPG issued its executive order, you relied on their credentials and you considered them qualified. However, if you look at their treatment protocols and judge them on that basis, I think you'll find they're not qualified. So I understand there is immense political pressure. There seems to be a lot of corruption within the medical community, but you cannot issue a mandatory mask order with insufficient, weak evidence. I've made mistakes in my life. You know, we've all made mistakes, but we have to fix our mistakes quickly. And just on this call, you've heard what's going on in our community. So if you guys really care about Hillsborough, if you do, then you'll remove the requirement. You'll remove this mask mandate, and you'll stop the social and economic suppression that has been imposed on our county. So please do the right thing. Follow the science, and remember the ideals of our country about freedom and liberty. Thank you.
Sunny Shaw.
Hello, thank you very much. I am a resident and employee of Hillsborough County, and I was just calling in because I wanted to address, as a recent college graduate, the economic devastation that these COVID restrictions have placed on the county, and, you know, the difficulty for people in my situation, college graduates, my generation, to find appropriate employment. I mean, does my generation even have an economic future at this point? And it keeps getting worse and worse. And on top of everything, the EPG has chosen now to mandate masks, which only serves to greater ensure economic loss on this county, putting businesses in a terrible position to where they now have to police their own patrons. And so the EPG's choice to mandate masks instead of allowing business owners and customers to freely choose is destroying businesses, and many businesses will never, ever recover. I'm concerned for the future of my generation, but I don't know that the EPG is concerned for the future of my generation. I'm 23 years old, and these are the things that we need to think about. And so I just am asking, I'm pleading with you that you would lift this mandatory mask order. Enough is enough. It's a total overreach of power. All we're asking is that you would not secure our health and our safety, but secure our liberties and leave that to ourselves so that we can secure our own health and safety on our own. Thank you very much.
Jennifer Cantor.
Hi there. My name is Jennifer Cantor. Thank you for hearing from me. I'm calling with a different perspective. I'm calling to remind you guys that you're in place to deal with emergencies, and that you have been put in a place that you've never experienced before. This is out of your normal hurricane, and I get that. Okay? You have always received, as our representatives, the calls from the people who disagreed with the choices that you are making, and that is what you're hearing right now. What you don't hear from is the majority of the people who are satisfied with the decisions that you've made. I am a 40-something suburban middle-class housewife. I am the bread and butter of this economy. I'm where the money comes from. I'm the primary shopper. I'm the demographic everybody wants in their store. My friends do not go spending their discretionary money because they cannot trust that when they go out, that they will be safe and safe to then go back and interact with their elder parents and the younger people in their lives, the people of our generation and our children who are also high risk. I have hundreds of dollars excess in my budget for the last several months because only necessary expenses have been done. None of the fun shopping, none of the discretionary stuff. So when the businesses are complaining that the mask order is what's keeping them down, remember, those of us who are trying to be cautious with our health are actually not going to their stores because we walk into their stores and see that they aren't enforcing masks, and we walk right back out. I'm telling you, Costco, which as a corporation requires masks.
Ms. Cantor, thank you very much. Your time is up, ma'am. Thank you, Ms. Cantor. Your time is up. Thank you. That was the last public speaker we had. We're going to close the public comment section of the agenda. We're now moving to emergency management update. Mr. Dudley.
Good afternoon.
Good afternoon, sir.
We continue to support mobile testing operations at remote collection sites today at Raymond James, Lee Davis, South Shore, Plant City, Brandon, Sun City, and Wamamo. Testing conducted last week, 8,750. Total tested since the beginning of the operation were over 48,000. We had 8,563 appointments scheduled for last week. We have 10,230 appointments scheduled for this week. We continue to support logistics operations. We have 8,801 kits on hand. We'll be receiving another delivery this week. We have zero guests at the quarantine site, 26 guests at the isolation site. We continue to push PPE out to the community, to those with unmet needs. Masks, we have over 2.2 million cloth masks that we've pushed out. We closed out the park operations as of last week. This week, we'll be distributing cloth masks through Hillsborough County library system. And here's a listing of the libraries that we'll be working with to continue putting out cloth reusable masks. And this concludes my update. Any questions?
Thank you, Mr. Dudley. I don't see, yes, Mr. Ivory, recognized.
Thank you, Mr. Chair. I just wanted to say thank you to Mr. Dudley and Liana Lopez and everyone who has created more space and more for appointments. I went on today to see what the length of wait time is now for an appointment, and it is only a week as opposed to the 2 weeks it was last week. And so that shows that that things are moving. It's still obviously not an ideal situation, but I know that people are working really hard to make those appointments happen. And the sooner that people can get in to test, the sooner they can know whether they need to quarantine, or maybe if they test negative, go back to work. Because that's another consideration. Is when you have to wait that long and you have to have a negative test in order to go back to work to earn a living, that is a consideration as well, how long it takes to get in to get a test, to test not just positive, but to test negative as well. So thank you for continuing to shorten that wait time for tests. I hope that it continues to shorten for the benefit of our community. Thank you so much.
Thank you.
I will pass that along to the team.
Mr. Dudley, thank you very much for your presentation, all that you're doing. We appreciate it. Thank you, sir.
Thank you,
Dr.
Mr.
Holt.
Chairman.
You're welcome, sir. Dr. Holt.
Good day. This is Dr. Holt from the Florida Department of Health, Hillsborough County. Today, I'll be presenting the updated EPI data as Kevin Wagner is off. I want to recognize and thank Ms. Emily Brooks for preparing it, and she will advance the slides as we go through it. We'll cover the core data that we present, which as a whole has remained relatively unchanged since our last presentation on Thursday. I would note that Dr. Chang will present portions of the data a little later on in his presentation. We'll begin with the first slide. Reports that 14,336 positive cases have been reported through 7/4. I would note that we did have a 340 increase, so we're now at 14,677, but that is the lowest number on a daily report that we've had in almost 2 weeks. Next, I was asked to look at the both the number of cases and the number of deaths to date as a percentage of the entire general population of 1.5 million. So to date, approximately 1% of the population has been known or had a test positive for infection. That's as of 7/4, about 1 in 100. Of note, about 80% of that did come in the month of June. Also, about 0.1% of the population has died, or 1 in 10,000. We were also asked to provide a number of the estimated recovered individuals. We define recovered as being alive 30 days after being tested. So it's sort of more of a survivor number. The way this is calculated is we look at the total number of infected positive cases as of the last day of May, and then we check and see the number that had died during that period through the last day of June. So we had a total of 2,554 cases through the last day of May, 150 deaths. We now have 2,404 that have recovered. So again, my estimate previously was 95 or 6%. So of the total that were infected during this period of time, we've had 94% of them recover. Let's see. Let's see, on to the results. Looking at our rolling 14-day average of cases, it is now at 624. While this represents an increase of 181%, when we get into the detail of the graph, I would note, call your attention to the 7-day average is actually decreased in the last 3 days. And as we talked about, we really want to start looking closer at the real-time trends. My hope is that this is a trend and that we have plateaued, but we will see. No matter what, that's still a long high number, and we'll have to get down significantly lower. Our tests, the rolling day number of tests continues to show increases. We're 63% of our target. We will need to upgrade or adjust this target as we move really into aggressive efforts to both enhance the surveillance and meet the challenge we have for control and eventual suppression of this virus. Our 14-day positivity rate is 20%. Again, as we look at the detail, the 7-day average is flattening. Emily, could you advance the next slide? Right. Our hospitalizations, the rolling 7-day average is 348. This is a 36% increase from our previous 7-day. Our rolling average of bed occupancy is at 76%, which while it's 3% increase, it is still below the 80% where we begin to get concerned. Our ICUs are showing increased occupancy up to 88% now. And this is something we are keeping very close watch on with the hospitals. Are approaching where they become stressed. The good news on this side is they're able to expand their ICUs to meet a challenge as it comes. Then there's the rolling 7-day average of admissions. It's currently at 56. This is a 10% decrease, but as we will look at in the data, the information we are reporting from July the 4th is incomplete. And then finally, for here, the deaths, we've had our average deaths per day is 2.57. This is not increased, and it was flat over the last 7 days. This is our slide that we review the big picture. Again, as I mentioned, the total number of cases, 14,336. The gender breakdown is really unchanged, and we've now tested almost 10%, 9.6% of our population. Next. This is our looking at the number of cases, positive results that come back reported to the state every day. And as you'll notice, the top line is starting to decrease over the last 3 days. While the 14 days still does show an increase, these last 3 days will hopefully start bending that down or at least flattening it out, but we'll wait and see. Next. This is our number of tests, and as you can see, the 7-day, as we are looking at it, has dropped down a little bit, but I think we're going to see a significant jump in that as the tests that Mr. Dudley and others have been doing over the last 7 days. Last week will start coming back this week, so I expect to see that significantly higher. That's our threshold, but as I mentioned before, we'll revise it up. Next slide. And this is our 14-day average of positivity rate. And again, we're high, but hopefully, again, as you look at the red 7 days, it's beginning to show some decreases or at least flattening in that rate. Next. As you can see, on the July 4th, that data was inaccurate, but we did graph it because that's what we had. And so that does skew the 7-day average significantly. And again, hopefully we are going to begin to see some flattening of this number as well. Next slide. And again, at the far right, you'll see the July 4th data is adjusted down or reported out down, but in fact, that data is incomplete. And again, the number of patients in the hospital at 387 are back up to the third versus those in the non-ICU 326, those in the ICU 361, both relatively steady ICU, but an increased number in the hospital. Next. This was an updated, we didn't have this last time we presented. Hopeful news again, the number of flu-like illnesses that report to the emergency room, COVID-like, I should say, have decreased from 1,072 to 954 over the 7 days past reported as of 6/28. Next slide. ready for or available for questions or comments.
Thank you, Dr. Holt. We appreciate all the work that you do from day one. I know that you have been hit with criticism about your reports. I think overall this board, this policy group appreciates everything that you've done, whether some agree with or not. You presented the facts, and that's to be commendable on your part. And just wanted to let you know that personally from me, that I appreciate everything that you've done. Commissioner Overman, you recognize.
Thank you, Chair. And I'll echo your comments to Dr. Holt. This has been a mammoth task for the Department of Health, as well as the county staff and the Emergency Operations Center. But it's also been a mammoth task for our business owners, and that's part of the reason today is so important. I am concerned that employers and employees are wrestling with how to stay safe as they service their clients. And I got a question this week that I didn't have an answer for, and I think it relates to today's conversation about mandatory masking. When an employee or an employer has someone that tests positive, and as we've seen, those numbers have been increasing of those that get tested, and we're doing a great job of getting people to test, and the numbers are bringing people to the testing centers, which is also good, so that we can find out what the level of community spread is. But when an employee or an employer, finds out that someone's tested positive and they're returning to work, they're not staying home, they're not quarantining, who do they call? What do they do? Because that sort of helps us understand some of the fear that's in the community. And what is the best course of action? Do they call the health department? Who do they call?
Yes, ma'am, this is Dr. Holt. They would notify the health department. Obviously, would have to confirm that the person is positive that's being reported, because they wouldn't take their word for it. We'd look at it. If it is, then we would communicate directly with that individual, reminding them very strongly what we had already told them, that isolation is required. I don't have a lot of enforcement powers. There is a statute that allows a enforcement. As far as I know, it's never been used, but it would require me to request support from the Surgeon General. That was the extreme. So we try very, very hard to convince the person to do what they have to do.
Okay, thank you very much. I appreciate all the effort that you put in to bring us current numbers. And I too am somewhat dismayed by the lack of trust of our medical professionals, but I appreciate your efforts in moving forward and making sure that we have good data to make good decisions. And thanks so much. I'll stop there.
Okay. Commissioner Merman, you recognize. Commissioner Merman?
Sorry.
There you go.
Yeah, there we go. Thank you, Doug, for all your work. It's a yeoman's task. I do want to ask you, somebody contacted me last week. He's with, is a physician with one of these urgent care facilities. It's a private facility. And he says they've been doing like about 2,100 tests a week. Wouldn't that just about put us over our goal if we included those numbers in with our testing numbers?
Well, yeah, 2,100, he would be adding about 300 a day to our target, along with those that are being done by hospitals or so certainly that's a significant contribution to that goal.
How do we get them to report how much they're doing so we can really look at this holistically and not just as what the county is doing, what the state's doing, and maybe some other relationships we have with healthcare providers in the community?
Well, I know this has come up before about are we not getting any results being done? So I guess I would, and if you're comfortable or they are comfortable, I'd love to offline talk to them directly and make sure that they're using, if they're using a commercial lab. I actually reviewed the detail of the state report, and it's almost 30 or 40 pages of list of labs that they get. And actually, they get labs that were drawn across the country, but if they're in a Florida resident, they're reported to us. So I definitely want to, if we're not finding 300 labs a day being in my system, I definitely want to know about it.
Okay. I'll have them call you. Thank you very much.
Okay, Dr. Holt. I think that was the only questions we had. So very good. Thank you so much for your presentation, sir. Is that it? You had anything else, Dr. Holt?
No, sir. That was my presentation. Thank you.
Okay. Thank you very much. We'll now move to the first report from the TGH, Tampa General Hospital Healthcare Systems. First, we have Dr. Peter Chang, who is the Vice President of Care and Transition and Chief Medical Information Officer at TGH, and then Dr. Jason Wilson, who is a USF Health Morsani College of Medicine. Dr. Chang.
Thank you, Chairman. Can you hear me?
Yes, sir. Good afternoon.
Right. So this is just in response. Thank you for inviting me to speak to talk from the hospital system's perspective. So some of the things I wanted to kind of clarify and some qualifiers. The data that you're going to see today is an aggregate between Baycare, HCA, TGH, and Advent Health. So the hospital systems have come together. What we'd really like to provide for the EPG is a service where we can rotate everyone through. So the idea is, I can present this week. Maybe you can get some other representatives from the other hospital systems to subsequently present the county data. So this is not any TGH specific data. So I just wanted to get that out there. The second thing is the data that you see on this dashboard here is from the Florida Department of Health. And I wanted to try to find a way to explain what's happening in regards to the number of positives we have, the number of tests we're conducting, and what the average 7-day rolling rate is for positivity. And so in doing this, we'll start off this is the beginning of March, as you see towards the left side of the graph. The orange little dots you see here are the number of new cases we've had for the day, and then the number of tests. So again, this data is all reported up through the state. This is Florida Department of Health data. So you can see as we weren't testing very much here, just under 1,000 tests a day here. And when we had our positives, our positivity rate was a little bit higher. We started off actually between 5 and 6%. As we started to go into considering safe at home, the rate started to decline, although testing stayed relatively static. Once we hit early May, the testing really ramped up through the hospitals in addition to what the county was doing. And so this blip you see in the positivity rate right here is actually the nursing homes, the long-term care facilities, the 2 outbreaks that we had that were pretty large scale. As you move through the Safe at Home program, you'll see we had a day where we really didn't test much. It was just a couple of hundred tests, and we did have some positives. So that actually resulted in that day a 10% positivity rate, which drove this little average up. And took a couple of days before that could fall back down. But that was just kind of an anomaly here. That's why looking at the 7-day rolling average really helps. Mainly from the purpose of, we know that when a sample is drawn and when it's resulted, it could be days away. And so that rolling average helps normalize some of that variance. Now, as we go towards the end of May and in the beginning of June, you start to see this rapid uptick in the percent positive 7-day rolling average. And you can sometimes equate to the number of positives that we're getting is due to increased testing. That is a true statement. The perfect example of that was about a week and a half ago, where we had our highest case total at around 1,100 cases in Hillsborough County. But you see that day we had tested almost 7,000 patients. So yes, if you test more, you are going to get more positives. But this 7-day rolling average of positivity rate gives a really good representation as to the community density of the virus. And so we went on this rapid uptick here up to around 14%, 15%. And then we are at an inflection point here. Do we have enough data points to surmise that that's the direction it's going to continue to go? But we are on a different slope that's less steep than it was previously. Now, I don't know what that really means, because another 2 or 3 data points, it could shoot right back up at the same slope. Only the future will tell. So I thought this was a good representation to look at, the less you test here, the less number of cases you get here in the orange. The more you test here, the more you get cases. And it's fairly consistent with the number of tests that we do every day here in Hillsborough County, and then the subsequent number of new positives we have per day. But by comparing all of these three, it gives you a lot of information as it regards to number of cases, the number of tests, and of course that positivity rate. As a comparison, I put what New York City's curve looked like at the beginning. And again, this is just New York City proper. You're comparing a population of over 8 million to a population of over 1 million here in the county. You sort of see at the beginning of, or sort of mid-March, the numbers that you see right here, where they were at about a 15% positivity rate, which is kind of where we were at right around here at that inflection point. Look at the steepness of the slope. And they actually went to an over 50% positivity rate in a very, very short span of time. I would say over a week and a half, 2 weeks time. I don't believe we are going to see that trajectory of increase in cases, but it does give you an idea of, as community prevalence falls, the more you test, as New York City is testing quite a few patients, north of 30,000 patients a day, and look at their positivity rate. So that's the comparison to say, if you're testing more, I do expect to find more positives, but only if the positivity rate is increasing. That is the marker for community prevalence. So hopefully that helps kind of clear it up. Again, I'm not saying that we are New York City. I'm just using this as a comparison to look at what they've gone through and the rapid speed at which cases increased, which overwhelmed their healthcare systems. The next slide I'm going to show you, again, you'll see different numbers from what Dr. Holt presented, because this is self-reported data from the 4 hospital systems that we aggregate on a dashboard. And so what this is looking at is the number of acute care. So this is non-ICU, just admission to acute care to the hospital with the systems we have. Again, the numbers aren't going to match up to Dr. Holt's data because this is self-reported and some of the hospitals are missing. Generally speaking, directionally, you can see what's happened from the end of April to the beginning of July. The gray line here represents the acute care admissions. The orange line right here represents the additional ICU admissions. And the blue line represents the patients that are utilizing ventilators. So that gives you, I know the EPG group asked for some general admission data and trends from the hospitals over time. I think this goes to show you the increase that we are witnessing within the walls of the hospital. I wanted to spend a minute or two talking about ventilators, because at the beginning and the onset of this pandemic, everyone was concerned with, do we have enough ventilators? Here at TGH, I can speak specifically for us, and I know this is the case with some of our other hospital partners. We're starting to utilize a different mode of oxygenation called heated high flow. And that really is much better for patients, because putting somebody on a ventilator, you do have to sedate them so they don't fight against the ventilator and they're in comfort. And so once you switch them over to high flow nasal cannula, you do not have to sedate them, but you can still oxygenate them enough. And the key to this is that they still use their respiratory muscles to breathe, because you don't have to paralyze them and have the machine breathe for them. So not to say that we are not reliant upon ventilators. Right now in our hospital, we have 13 patients that are on ventilators, but we have about just as many on heated high flow, and we're able to sort of hold off using a ventilator until we absolutely need to, because we know we've seen a lot of patients turn in the right direction and not have to go on a ventilator. So I think the state is a lot different now than it was at the beginning of this, as we're starting to learn more and more about the modalities and how we treat them. This right here just gives a snapshot of overall occupancy in the hospital. So as you look here again at the end of March, as you march through the data here, you do see that upward trend. This is all comers, so all patients that are admitted to acute care, again, not IC, or excuse me, to ICU. Sorry, I misspoke. This is to ICU. You can see the uptick here where we're well over 200 patients, close to 300 patients at times, as far as the number of patients that are admitted to an ICU. As you look at this red line here, you'll see the number of COVID admissions, and it is on the rise. As of the end of last week, roughly around 20% of all admitted patients in the county were COVID positive, and then those are admissions to the ICU. Moving on to the acute care space, it's what we call med surg. These are medical and surgical admissions. As you look here, again, we started off at around 1,000 and have upticked to close to 1,500 as a county-wide census. And looking here, you do start to see the uptick of admissions, and we're running right around 10 to 15%. It depends on the day of every single patient admitted to the hospital for COVID-related illnesses. The last two slides I have for you here are just to look at ICU census by region to see how we can stack up against our neighboring counties. Pinellas is faring a little bit worse in regards to the number of total ICU census, as you see here. And you can also see some other counties down south are also having close to 50 patients in their ICUs. The last slide that I'll finish up with here is again, acute care admissions. Just looking, the trend follows with Pinellas having a little bit more admissions than Hillsborough has at this point in time. So before we open it up to questions, I'd like to pass it over to Dr. Wilson so he can share some experiences from the emergency department.
Good afternoon, Dr. Wilson.
Hi, Commissioner Miller. Thank you for having me, and thank you, members, for having me back again. What I'm actually going to do is not give you more data slides. I think there's been a lot of data slides. I'm actually going to try to give you some color. I've been in the ED working the last weeks in a row, and obviously following this closely since March as well. Let me try to add some color to this, and also try to add some clarification to some questions that came up on Thursday in terms of admissions and what this looks like right now and how this looks different. So what I talked about last time I was here was that we were starting to see a larger volume of admissions or at least presentations of people coming into the emergency departments who were younger and were more asymptomatic than what we had previously seen. So that has continued, but also there's been some interesting shifts in that as well. So let me just talk through that for a moment. On June 18th, we stood back up our alternate care site, which is essentially a set of tents that are underneath the emergency department ramp, and they act to deal with surge volume. We started seeing a pretty significant surge volume secondary to a couple of specific super spreader exposure events that occurred mostly in the South Tampa area. We started seeing high volumes of younger people coming in to be tested secondary to those known exposure events. That really started to increase in volume rapidly. To give you some idea, when we had the tent of the alternate care site open in March and April, we would see maybe 20 people a day through that area. In this period of time between June 18th and the rest of June, we began to see over 100 people a day, peaking on June 20th at 305 patients through that alternate care site. And again, that's an area that's designated as a surge disaster area underneath the emergency department. Now, just to give some idea of what admission numbers look like, when you come into the emergency department, you're basically pivoted into whether you're there for a COVID-related complaint or non-COVID-related complaint. If you're there for a COVID-related complaint, our triage nurses assess very quickly as to whether you're sick or not. These younger people who don't look very sick, or even other people who just don't look very sick, they're sent down to the alternate care site when it's open. They're tested and they're essentially discharged right away. So for these last two or 3 weeks or so that we've been doing this, we've been seeing, again, over 100 people a day in that area, discharging those patients really essentially as soon as they're swabbed. But then seeing essentially a positivity rate that's over 15%. On that day I mentioned that had 300 and something patients in it, we saw a positivity rate in the 20s, in the 20-something% range. All of those patients essentially go home. They are not admitted to the hospital. We met, and Mayor Castro mentioned this last week, we met maybe one patient out of all those patients from down under the alternate care site. Now, the other space that we also utilize is the emergency department space itself. So you come in, you say you have a COVID-related complaint, but you appear to be a sicker patient. Maybe you've had a transplant in the past. Maybe you have other medical problems that are significant. You look sick. Those are brought to the emergency department to a special safe COVID area. Now that place has a much higher admission rate because you already have been decided to be sicker. So we've seen both the area under the tent, the alternate care site, get much busier. We've also seen that area of patients we've brought into that separate space in the emergency department get much busier. The challenge there, really starting again around that mid-June mark, has been that there are so many of those patients who seem very sick that the admission rate has gone up quite a bit. To give you some idea around that, on an average day in March or April, our COVID census in the whole hospital for admitted patients might have been, between 15 and 20. Right now, on a given day, it's over 60. So what this has done is that patients who are admitted to the emergency department or admitted from the emergency department into the hospital with COVID, they would normally go to a different area of the hospital, to a COVID unit. But those areas are beginning to fill up. And as those areas fill up, that means we have to use other spaces. And so spaces in the emergency department now have been essentially retrofitted to become inpatient units for those patients. So we've been using more and more space. We actually have 2 spaces that have been converted to keeping those patients there as admitted patients. And this has come up a couple of times, so I want to make sure I clarify. When I say admitted, what I mean is that the emergency department care has ended, and I've called an internal medicine team, a COVID internal medicine team, to take over care of those patients. So that means they're going to be there for more than 24 hours. They're going to likely have a long hospital course. My colleague, Dr. Myers, couldn't join us today, but I can tell you that the hospital course for an admitted patient with COVID is pretty long. About 40% of patients who get admitted with COVID are going to go into more of a critical care type of area. And those that go into a critical care ICU type of area have a very long length of stay. Those are the patients Dr. Chang mentioned a few minutes ago who may need things like heated high-flow nasal oxygen, which has been very helpful because it's decreased the number of patients we have to intubate. And obviously, if we don't have to intubate the patient, it does take less resources, but they are still resource-heavy patients who may have long lengths of stay. So we are seeing patients get admitted both in those 2 areas, and essentially you have to stay there because other areas of the hospital are also filling up with admitted patients with COVID because of those large numbers. So those areas are essentially kind of always full. We're sort of always working to discharge those patients as soon as we possibly can do that safely. The COVID skilled nursing facilities has really helped. So I do thank the EPG for helping get those online and running. Those have definitely helped the teams decompress that volume on the other side. Now, the other thing I do want to mention, which has been really interesting over the past just a couple of days, is another shift that's taken place. And that shift is, I think, one that New York City saw, which is a little bit troubling. It just speaks to the prevalence of disease out there. We're starting to see more and more patients in our normal emergency department space also recognized to have COVID. And so either they have had COVID for a while and they are struggling with other diseases they have. They might have heart problems or lung problems, and now those problems are manifesting on top of their COVID. Or just they come in with their heart problem and their heart problem has been exacerbated because now they also happen to have COVID. So, my last 4 shifts that I've worked over the past 4 nights, at any given time, 30% of my other non-COVID patients also had COVID on top of the medical problem they were experiencing. Just given some color to the fact that community density is very high right now. So overall, this seems very concerning because we're consistently at about 20 admissions per day. Where in March, April, and May, we are really a census of the hospital about 20. So we're trying to discharge as many of those patients as possible, but we might only discharge 5 to 10 a day, and we're admitting 20 a day. So you can see the math doesn't quite add up there in terms of balance. So that's been the struggle for our internal medicine colleagues who are seeing those patients and treating them on the inside of the hospital, and for us who are trying to find them a safe place to go once they're admitted. Now, I just try to help answer some other questions I heard on Thursday while I'm talking through some of this. When we admit a patient, we consider them for a number of treatment strategies. Really, unfortunately, unless the patient is very sick, the science really isn't there yet for a lot of the treatment modalities that we've talked about. So what I mean by that more specifically is that if a patient requires oxygen, they're very sick and they require a heated high flow nasal cannula, oxygen support, or intubation, there are some treatments that have proven to be beneficial. Member Snively mentioned the steroid study, the dexamethasone study last week, and that is a very good signal study. We're very happy that study is out there. We are evaluating those patients, putting them on dexamethasone. We evaluate them for the antiviral medication, remdesivir, which I think most people have heard about, and we evaluate them for convalescent donor plasma. But unfortunately, the patients who don't require those things really don't have at least an FDA, sort of approved or evidence-based sort of approved medical treatment. As a matter of fact, just to give you even more idea about what these numbers look like, because of that, we've gotten much more aggressive about the type of patients we will discharge. At this point, we have actually diverted quite a few admissions that would normally have been in those numbers. You're no longer seeing those numbers, but are still very sick patients. What I mean by that is unless you require oxygen, we probably will not admit you at this point unless you have other medical problems that require admission. So if you're a transplant patient who has a new heart and you have COVID, yes, we're going to admit you. But if you're another person who has COVID and you don't require oxygen, we're probably going to discharge you from the hospital. Whereas before, we might have looked at some other markers and indicators to see if you need admission. So our team, the emergency department team, has started to work very closely with the outpatient COCO clinic, which is the COVID follow-up clinic, to put some pretty sick patients back into the community when possible to try to bring down those admission numbers. So I just want people to understand that when we see those hospital admission numbers, those are definitely real admissions, people who are coming to the hospital to stay for a while, and they're after we've diverted quite a few other admissions from that population. The other thing I think, I just want to add some color to Dr. Chang's slides for a moment. The New York City experience, the reason why this is concerning to a lot of us is that when we look at New York City's experience compared to ours, it really seemed unfathomable to us, I think, for a long time. I think for all of March, April, and May, we really never saw ourselves as even having a possibility of reaching New York. They were 100 to 500 times magnitude higher in their cases per day, their per capita cases per day than we ever were. But what we saw really since about June 20th was that when we reached about 400 cases per 100,000, when we reached that number, comparing to when they did, we then reached the 900 cases per 100,000, the exact same speed. So we're right now kind of, they were ahead of us in the race, but we've caught up we've now caught up in the race and we're driving at the same speed, kind of where they were in the race on the race car. And that's the part that's concerning to us right now is we're tracking kind of along the same direction. So I hope that adds some color. I'm here for questions, but I hope that helps. Thanks a lot for having me again.
Thank you, Dr. Wilson. Thank you both, Dr. Chang and Dr. Wilson, for your presentation. We do have some questions. Commissioner Overland, you recognize.
Thank you. And thank you, doctors, both of you, for bringing this very good information on how the hospital system is actually managing the ICU beds. That's been a number that people have used to say we're really not in trouble. But actually what you've just told us is that you're managing it as best you can aggressively to keep those numbers low. So I don't want to see us criticize or have your success actually end up being our worst enemy here. The 7-day average numbers are concerning. And what we saw is clearly a real spread in June, if I'm not mistaken. Looking at the Dr. Chang's slide, it's very clear that come June 5th through, say, the 19th, that acceleration, is that the acceleration, Dr. Wilson, that you're speaking about, that mirrors what what New York actually experienced? Is that time frame? Because that's
it's sometime in mid-June is when we really start to see that time frame. I've been looking at sort of 7-day averages at each little block of time, And it's, that period in mid-June where every 7 days since then we've really been, and you can see that straight, or at least, that line of Dr. Chang showing right there, that very steep roller coaster line. That line, if you were to take the New York City line from about March 25th until, about 14 days after March 25th for New York City, those lines are laid on top of each other essentially perfectly.
Okay. The reason I asked that question is, it looks like after we put our mask order in place on the 22nd, the numbers started to wiggle a little bit or flatten out just a tad. When did New York, based on that prior slide, when did New York put its mandatory mask order in place?
Yeah, they actually had it behind us. So they had about a 5-day lead time before they sort of took off at the same time we did. They had about a 5-day lead time on us of actually already having some of those ordinances in place, which allowed them then to sort of bend their curve, with a lot of other aggressive strategies they had, sort of bend their curve at about 3.5 weeks out of those aggressive strategies. So they picked it around 2,000 cases per 100,000. Essentially 3.5 to 4 weeks after they took off.
Okay, that helps me because I'm trying to figure out if we're looking at our 7-day numbers and we're starting to see that our citizens are doing a great job of following the mandate. Are we working in the right direction? Because that 40% of needing critical care number is a little concerning. Especially if the spread continues at a rate that it did in the early part, mid part of June. And that is the way spread happens, is it starts to exponentially increase the more people get exposed. So I guess my question is, I don't want to have success be our failure. I mean, you guys are doing a really great job, but, we've heard from a lot of sources the value of mandating masks. And in your opinion, do you think we've seen some of the impact of putting the mask order in place yet?
Yeah, it may be a little early to know exactly if we're seeing that. I think we're also sort of seeing, just to give you some ideas of other things we're seeing, I'm still seeing patients who've been at social, events, things like bars. I'm still seeing those types of patients come in as well. That's concerning. I think it's going to be hard to, have a mask. It's going to be hard to have the mask work if we still have young people going to bars, when there's a bar ban. I think that we need to watch and monitor the mask data. I always kind of give it about 2 weeks, after an intervention that we should start to see some type of change. So we're, coming up on that. And so, we should start to see some of the data Dr. Lakshmi, brought up last time she presented in terms of what type of, decays we should see in the growth curves based on the mask ordinance, alone, essentially. So,
okay, and then reminding us how long the critical patient, the critical care patient is on average staying in their ages, because what we're looking at is the disruption in that person's life and their economic opportunity to take care of themselves and their family, right? So if they are in the hospital for, 5 or 6 days and they're sick for a little while longer, that's no big deal. But I'd like to get a better understanding of who is actually getting admitted and what is their timeline look like towards quote unquote recovery.
And that's the spot, but he may have some data around that with him.
Yeah, we did present some of the admission data by demographic, just for TGH specifically, I believe around 2 weeks ago. And we are planning on bringing that data back at a hospital collective between all the hospitals to present to EPG at a subsequent meeting. We're in the mode of collecting that data right now. To the point that Jason was making, I would say our youngest intubated patient on a ventilator right now is 26. And we admitted a 103-year-old yesterday that's on heated high flow. So we see the complete range of patient populations in regards to ages. In fact, there's an interesting story on the 26-year-old patient. She was actually discharged home from the hospital before with monitoring. We actually, as Jason mentioned, we have the coronavirus continuity clinic that USF helps run where we monitor patients. We actually sent her home with a continuous pulse oximeter on her finger that automatically fed data to those clinicians to be able to monitor her at home, and they started to notice a decline about 5 days after she was discharged, and we took her back in, and she needed to be put on a ventilator. So, you know, we have all the different types of stories. That's one anecdotal story on one specific patient, but we have kind of the whole gamut. And to me, if we have more than one, which we do, we have many patients in their 30s and 40s that are also on ventilators. You know, it just goes to the point that Jason was saying. The census this morning was 71 coronavirus patients, with about 26 of those in the ICU. So, you know, that kind of gives you what we woke up to this morning, kind of coming up into the hospital, and that's kind of been the trend over the last week.
Let me just jump in too, because I know one of the things that come up a lot are what type of metrics we're looking at in terms of the resource intensity. But you just described a pretty typical patient. I think it's important for the members to understand that for a lot of these patients, there's a sort of constant data monitoring, cognitive spend, provider dedication to trying to figure out today, is this patient still okay at home? Is this patient, now that's in the ER, coming back, you know, about 5 to 7 days often after they first, you know, get diagnosed? Do I need to bring them in? I need to meet with the internal medicine team. This is a lot of resource just intensity, thinking about putting resources into the patient's corrective disposition. It's much higher than other patient types that we see.
And then my last question has to do with...
Yes, last question.
Yes, my last question. Asymptomatic versus symptomatic. Are you seeing the ratio being more or less symptomatic, or are you just not seeing asymptomatic patients?
So yeah, great question. That one of the reasons I wanted to I walk through that alternate care site model a little bit is I wanted to demonstrate that we still see a lot of asymptomatic patients, and we still see a lot of people who are doing just fine with virus. The problem is that what we're seeing kind of related to that is that the higher that number goes up, the more we see the other number go up as well, the sick people showing up inside the ER. So we see these volumes of 300 people down in the alternate care site, 20% of those are positive, maybe 2 of those patients are sick. So most of those patients do okay. Now, somewhere between 5 and 8% of those patients that we saw in the alternate care site probably come back 5 to 7 days later. And they are sicker when they come back 5 to 7 days later. They also will spread to 2.5 to 3 people as well. And so some of those people get sick as well. And that's what we're, I think, feeling as we see that relationship now between the high numbers of people who are community spreaders and now also these people who are getting very sick. And we're feeling that right now, I think, in the emergency department and hospital.
Okay, Mayor Ross, you recognize.
Thank you, Commissioner Miller. I have a question for Dr. Wilson. Early on in your presentation, you talked about super spreading events that some of the young people that have been reporting in large numbers to the emergency department had attended. Can you speak more to that, please?
Sure. And, I'm not the contact tracer or the person, who, epidemiologically nails this down, but just from talking to patients and seeing them when they come in, what will often happen is they will identify a certain, bar, restaurant, nightclub, or the graduation parties, I think, were a really big one in the city of Tampa, a couple of weeks ago in that mid-June period, where they will basically recognize that a friend, another person at the place, either the restaurant, the bar, or the party, had a positive test, and then it's not uncommon the entire group of people who come in from that location or that party or that place, they will all have positive tests. We're really at that point where we can just basically expect those tests to be positive if they're in the same spot.
Okay, thank you. So, and this isn't intended to be a political statement, it's a scientific question, but are you seeing, there's a lot of talk anecdotally about the protests, and some of the protesters are wearing masks, some of them aren't, but most of them are in close proximity. Are we seeing, or are you seeing, positive cases in significant numbers coming from protest activity?
Yeah, again, not to be too political about it, but I honestly have not identified a single patient coming from a demonstration or identifying or self-identifying the demonstration as the place they think they were exposed. And I don't know if that is because those are, outdoor gatherings where people are moving quickly past each other. I think the science of this is really starting to coalesce around the idea of, us sitting together in close proximity, in a very, in a normal social type of environment where there might be, touching, loud talking, sharing, intimacy, all those kind of things, I think are the things that are becoming, sharing meals, all that kind of stuff seems to be the real way this virus spreads quickly around communities.
Okay, thank you, Doctor.
No problem, sir.
Commissioner Merman, you're recognized.
Thank you, Mr. Chair. I'll keep this real brief. Dr. Wilson, thank you, and both of you, Dr. Chang, thank you. Your information was really important. I think what I'm hearing, though, is that you're shifting some of the admissions data onto people that you're not admitting. You're sending them home on monitors, and that may affect, maybe the listening public. When they look at our admissions, they would, say kind of a false sense of security that, oh, wow, look at their admissions are down. So we don't need to wear masks. I mean, the numbers are getting better. I mean, how would you respond to something like that?
Yeah, I'll take that one first. Pete wanted to jump in, but that's exactly right, Commissioner. That's one of the reasons I wanted to bring up how there might be other metrics or other outcomes that are important to look at, other than just the hospital admission data, that resource intensity of the patients we're discharging. Patients both on the emergency medicine side and on the hospital side, patients who had probably been admitted in a previous world or patients who have stayed in the hospital longer in a previous world, are still safely being discharged because we put a lot of resources into building out systems of care, like the monitors and other devices that people can go home with now. But those definitely, if anything, we are underestimating the true, sickness of people by looking at that admission number. That admission number is high enough already. And again, those admission numbers, when we see them, those are true admissions to the hospital for people who are pretty sick, who are going to have a reasonably high length of stay.
Well, we're trying to let data drive our decisions here on the EPG. We have kind of shifted that way. And I'm just worried. I don't know how you can account for those people in a non-admission data set so that at least we see they're entering a hospital. You're just releasing them on a monitoring basis.
Right. Well, I think one thing, because I've heard this question come up a couple of times the past few weeks on this committee, is I think we can at least recognize that the hospital admission data, those are patients who are really being admitted. Those are patients who are truly coming into the hospital. So that those numbers themselves we can trust as representative of at least real admissions data, not people who are going to sit in the ER for a few hours and go home. Those are people who we've turned the key on and they're coming to the hospital to stay. So we can at least trust that data and help that guide our decisions that we're seeing for high admissions as we think through some of the other ways we might be able to monitor these people who are still being followed in the community.
Well, maybe Dr. Chang can answer this. Are other hospitals kind of doing the same thing? Or is this going to be like now our data is going to get all kind of gray?
Well, from what we presented, we are definitely showing an increase in admissions. So I want everyone to, make sure they understand that. And the larger proportion is going to the ICU. Right? When we have 20% of all of our ICU beds in Hillsborough County are occupied by COVID patients, it's a pretty powerful statement for where we're at right now. Other hospitals are sort of deploying similar strategies. Again, as the standard is to take care of patients in the best setting as possible, which I would say would be their home, right? That's the idea of trying to take a good care of a patient, unless they really need a hospital admission criteria or need to be admitted to the ICU. And so to Dr. Wilson's point, the admissions that you're seeing that are rising are really the sick patients that do need to.
Okay.
Mr. Merman, just to give you some idea of that trend again, in March, April, and May, we may have admitted 5 to 8 patients per day with COVID. Now we're consistently admitting 20 patients per day with COVID. if we were still finding the same criteria we were in March, April, and May, we'd probably be admitting 25, patients a day with COVID. But even on its own, we're still admitting probably 3 to 4 times as many patients a day with COVID that we were in March, April, and May.
Thank you.
Mayor Castor, you're recognized.
Thank you, Chair. And thank you, Dr. Chang and Dr. Wilson, for all you've been doing. Much appreciated by our community. Now, a couple of things. One, with the demonstrations, Mayor Ross, I read, because that was a concern for me as well, for a good reason. And I read a couple of articles that there were other states that had many more demonstrations and much, much larger than ours that didn't show increase in the number of COVID. Of course, there's no scientific data that I know of. I'm just convinced the opening of the bars was not a good move, despite the need for taking care of those small businesses. But a couple of things. One of the callers earlier sort of indicated that the lower death that we had in our community was somehow acceptable, and I take a real exception to that, because if that's a member of your family, then clearly any death is unacceptable, and it should be unacceptable to all of us. And if you look at the number of individuals that have presented themselves to the emergency room and skyrocketed, as stated by both doctors, the number of those admitted have gone up, the number in ICU have gone up, and as must the number of deaths is going to go up. And so we have to do as a community everything we can to try to stop the spread of this. And the one step we can all take that is incredibly simple is wearing a mask. That's it, sir. Thank you.
Thank you. Ms. Nabby, you recognize.
Thank you, Mr. Chair. Thank you, Dr. Chang, Dr. Wilson. I just wanted to point out some information that we had in our presentation last week that may address Commissioner Overman's question about hospitalization by age. And so I would ask perhaps Dr. Holt maybe put that slide back into his presentation for Thursday, so that we can see the hospitalization by age group versus census population. And it gives you a pretty good idea of what age groups are being hospitalized within our county. I thought that was helpful information to get a good idea of the age ranges of people being hospitalized. So that's all I have. Thank you very much.
Okay. Chef Cronister, you recognize.
Thank you, Mr. Chair. Quick question. We were told, this group was told on a couple of different occasions, that if we implemented a mandatory mask policy, we would see significant reductions in the tune of about an 80% reduction in positive cases. We're on day 14 now, and we haven't seen that. And I guess my question is to one of any of the medical personnel, does anyone have an explanation for that?
So with the virus, and I'll let Dr. Wilson also weigh in. We know already that there's up to 14-day incubation period for this virus from the time of a suspected exposure to the development of symptoms or testing positive. So, right now we're at about 2 weeks. We wouldn't have expected, as Dr. Wilson mentioned earlier, to see anything yet. It's sort of, I kind of take it, coronavirus, it's a 2 to week 3 thing. And what I mean by that is, from the time we start seeing trends from a rise in ED volumes, 2 weeks later, we start to see a rise in admissions. 2 weeks later, we start to see an increase in ICU utilization. And unfortunately, 2 weeks later, we start to see an increase in the number of citizens that pass away. So, we have to look at it from that lens, I think. It's a little bit too early to see this really in full effect. And I'll pass it over to Jason to weigh in also.
Sure, thanks, Dr. Chang. So usually I am the data guy, but I'm actually going to give you an anecdote because I just spent the last 4 days working clinically. So that's kind of what happens when doctors work clinically. I took care of a patient last night that came from a bar in Ybor City. The patient told me that they were not wearing a mask at the bar, nor was anybody else. And the patient, and I was a little perplexed as to how they're at a bar, but I didn't go into the legal parts of that with the patient. But they did tell me they came from a bar. And they also told me that 3 of their family members had tested positive that weekend. They felt fine, but they lived with the 3 family members. So they wanted to go to the bar. So they were at the bar last night and had an associated injury at the bar. So just to give you some color as to anecdotally about why we might still be seeing some spread, there you go.
Okay. Commissioner Merman, you recognize.
I'll take my hand down. Sorry.
Okay. Dr. Chang and Dr. Wilson, thank you very much for your presentation. We truly appreciate you being with us today. Thank you very much. Take care. Stay safe.
Thank you.
We now have an update on the meeting between Vice President Pence and Governor DeSantis. Mr. Brandon Wagner, you recognize.
Good afternoon, Mr. Chairman and EPG members. Thank you for the opportunity to make a brief presentation to you. This morning, I emailed out a video clip of that press conference and also a transcript of that meeting for your review and consideration. As you're aware, that meeting took place during your EPG meeting on Thursday the 2nd. The event started with a roundtable that included leadership from Tampa General Hospital and the University of South Florida. And while the roundtable discussion was closed door, we understand that the topic centered on patient care, solutions to address the coronavirus disease, and the importance of individuals keeping themselves safe. The aforementioned press conference afterwards included the Vice President, Governor, Federal Coronavirus Response Coordinator, Dr. Deborah Birx, U.S. Health and Social Services Secretary Alex Azar, and Food and Drug Administrator Stephen Hahn. To briefly summarize, the governor reported that Florida has vastly expanded testing, that the median age of individuals testing positive has decreased, that seniors remain the most vulnerable population, and that there are now 12 COVID-only nursing homes statewide with 750 dedicated beds. The Vice President and the Coronavirus Task Force members pledged ongoing support to the state, provided updates on new medicines and vaccines for treatment, and will be taking into consideration the state's request for additional medical personnel. As indicated, these issues and more are covered both in the transcript that was provided, along with the full video of the press conference. With that, Mr. Chairman, that concludes my report. Happy to answer any questions.
Thank you, Mr. Wagner. And I see Commissioner Overman recognized for a question.
Mr. Wagner, thank you very much for that report. I appreciate it. I thought it would be important to hear what our Vice President had to say. And in the transcript of just for the public's consumption, the Vice President actually said, if all of us will put into practice the guidance from state and local officials, which is wash your hands, practice good hygiene, wear a mask when it's indicated by local officials, or wear a mask when you can't social distance, we know that we can do what Florida did for so many months, what other impact it did around the country to slow the spread. We can flatten the curve, but it will take all of us to do it. I appreciate his words. It was also said by Dr. Birx and reiterated by other professionals there. And I really want to thank this EPG for hearing those words and putting something into place and for you to bring to us what the Vice President had to say. Thank you.
Okay, Mr. Wagner, that seems to be the only question, so thank you very much for your presentation.
Thank you, Mr. Chairman.
County Administrator, Ms. Bonnie Wise. Good afternoon, you recognize.
Thank you, Mr. Chairman and EPG members. And as many of you know, I'm Bonnie Wise, and I'm the new Hillsborough County Administrator. And although today is official day 6 in this position, I've been with the county over 9 years and have been participating with the emergency management team and other staff regarding EPG matters, so I'm very familiar with the issues. Today I'm going to provide you with an update regarding the various support activities that staff is providing. However, they're also here for questions. Although you may only see some of the staff at these EPG members, I want to assure you that the various staff from many jurisdictions are behind the scenes spending a lot of time helping to prepare for these meetings and to provide you with the information that you request. In an effort to be as responsive as possible, if you have any requests for us, please feel free to share it with us in advance so we can provide that information for you at an upcoming EPG meeting. We recognize that certain requests may transpire based on the information or data that's presented to you at each meeting. So this might not always be possible, but as much advanced requests that we have, the more responsive we can be to you. The other item that you might want to consider today or in the future is to have one meeting per week to help staff preserve time as we are also preparing for hurricane season and other duties. Of course, if you do so, we can go back to twice a week if the situation warrants. I wanted to give you an update regarding the dashboard that we have previously discussed. County departments continue to work with our partners, the Department of Health and the hospital systems, to have a COVID community dashboard up later this week. We want to ensure that this information is timely and relevant. And we're hoping to include some of the information that you saw from Dr. Chang in the county dashboard as well. The call center continued scheduling appointments Friday, July 3rd from 8 a.m. to 5 p.m. And as a reminder, the call center is open 24/7 for general questions related to COVID-19. And Monday is generally our busiest day of the week for the call center, with calls spiking in the first hour in the morning. And the longest wait time this morning was just over 10 minutes in the 8 o'clock hour. The average wait so far is only 44 seconds. We have 65 agents currently taking calls today, which fluctuates according to the number of calls coming in. And as Ms. Snively mentioned earlier today, the soonest available appointment is about July 14th right now, with approximately 1,300 appointments available through July 23rd. And as a reminder, with the state support, we have more than doubled our testing, expanding to nearly 9,000 tests per week, with testing determining the availabilities determined by staff, test kits, PPE, etc., as Mr. Dudley has previously discussed. Subject to availability, appointments can be made through the Hillsborough County website, or citizens may also call 888-513-6321, weekdays from 8 a.m. to 5 p.m., and online is available, as I mentioned, 24/7. As Liana Lopez mentioned on Thursday, the website also provides other testing options for citizens, as there are many other options available. These other testing options are really important as part of the overall testing solution, because the county only provides approximately 20% of all tests performed in the county. Of course, if someone is ill, we've had questions about that. They should contact a medical professional or 911 if necessary. Additional test sites are being considered in the town and country area, and one at USF. We have the goal to establish the town and country testing site around July 17th, and we will further our discussions with USF to locate a site there after that Northwest site is established. Communications has also made available a face covering digital toolkit for businesses, and that's on the county's website, and that includes signage and tip sheets for their use. And finally, Communications has also added the new webmail for EPG members, and that webmail is currently live. And I hope that this answers some of the questions that have come up and summarizes our various activities. And we are available to provide any questions, answer any questions. Thank you.
Thank you, Ms. Wise. Commissioner Merman, you recognize.
Thank you, Mr. Chair. Bonnie, great to see you in this role. I'm very excited. I just want to ask a question again to clarify for the listening audience. If somebody is really sick, they think they have COVID, they can't get an appointment till next week, your call center people are giving them what kind of advice?
Our call center is providing information on alternative test sites, as well as ways to get further up in the availability to get a test.
Are they telling them to go to the emergency room?
If someone is
Is that
very
one of
sick,
them?
that is really what they should do.
Okay. Okay. I just wanted to make sure that they were giving good advice on that, because I know there are people out there that are sick that think they have to wait a week to get tested. And I don't think we want them to wait a week. So, and then we might be liable. So that was my only question. Thank you very much. And welcome to the county administrator role.
Thank you so much.
Ms. Wise, I don't see any further questions. Again, thank you for your presentation. Thank you for accepting the job as our county administrator. And the only thing I can say to you is God bless you.
Thank you.
No, I'm just kidding. I'm just kidding. We're here for you, Ms. Wise. You know that. We're here to do work together to get everything done in this county. Again, thank you very much. Ms. Christine Beck, County Attorney.
Yes, good afternoon, EPG board members and Chair Miller. Christine Beck, County Attorney. Last Thursday, we distributed a redlined version of your face covering order based on the direction that you provided to us at your June 29th meeting. Before addressing the redlined revisions, I wanted to briefly summarize the face covering order. The order was first approved on June 22nd. The order provided for enforcement only against businesses, and the onus was placed on businesses to seek compliance with the order as a way to mitigate impacts on law enforcement. The face covering order was approved for another 7 days on June 29th. In addition, as a result of the votes taken on June 29th, there were 3 amendments incorporated into the June 29th order. The first was that persons under 8, as opposed to 2, was accepted in paragraph 9. And the second is that children under the age of 18 participating in youth activities, childcare, summer camps, etc., were also accepted. And the third was that the definition of business was modified to make it clear that the order would also apply to nonprofits which offer goods or services for sale to the public in an indoor location. The red line draft distributed last Thursday tweaks the June 29th order in 3 ways. And this was all based on the discussion and direction that we received during the June 29th meeting. In response to the concerns raised about paragraph 7 of the June 22nd order, the order's requirements related to business operators in the red line order now provides that if business operators do the 4 things listed in paragraph 8, and those were specifically suggested at the June 29th meeting, then the business operator would be deemed in compliance with the order. And those 4, which are now set out in paragraph 8, provide that the business operator shall provide signage or post signage indicating that face coverings are required. They're to use a PA system, if equipped, to remind patrons that face coverings must be worn. They must require all employees who aren't exempt to wear a face covering. And they must make reasonable efforts, including asking patrons not wearing a mask to do so, or at least to inquire with them. If those 4 are done, the business operator shall not be subject to any penalties under the order as written in the current red line draft for your consideration. And the second way that the June 29th order was tweaked is that in the prior order, individuals were not subject to being penalized under that order. Based on the discussion that we heard, we've added in paragraph 5 that individuals who are not exempt and who fail to comply with the order after being asked to by a business operator or employee may be subject to the penalties in the order for violating the order. And the third change is in paragraph 12, which contains the enforcement and penalties for violation of the order. In this red line version, the order may be enforced by code enforcement and law enforcement, and a non-criminal civil citation may be issued, and the suggested fine amount is $150. I would like to recommend one additional change to the order in your backup materials, and that is with regard to paragraph 9C. We recommend deleting everything after the word thereof in line 4. This was a clarification added after board discussion that makes it clear that an individual claiming a health exemption does not have to identify the condition or supplied documentation. That part will remain. However, the sentence beginning with nor shall any business operator deny such person admission or service, we would recommend that that be stricken simply because of a worry that it would be misinterpreted. And in hindsight, it really is up to the business operator who can determine whether and how he or she wants to operate their business. Finally, the face covering order will expire today if it is not renewed. And with that, I'm available for questions or any comments. Thank you.
Thank you, Ms. Beck. Appreciate it. Thank you very much. Commissioner Overman, you recognize.
Thank you very much. First off, Ms. Beck, thank you for your team putting together the work on this document. There were a lot of comments last week, and you grabbed all of them that I could hear. I know it's a small task, so I'd like to recommend 3 minor changes, one of which you've already referenced. The first change would be under Section 9C, that would strike the following language: nor shall any business operator or employee deny such person admittance or service because he or she is not wearing a face covering. As we attempt to balance many different interests, my concern is that it precludes an employer from being more restrictive in their business setting. For example, there are places such as nursing homes, hospitals, clinics that may require the use of facial coverings for protection of their employees, their patients, and staff. This language may preclude their ability to enforce those requirements. So striking that would accomplish that and would allow them to protect their employees, their staff, and their other customers. There are businesses that have risk factors and have employees that have risk factors that also need protection. And with that being removed, I think we're removing, with this change, I fear we are removing the integrity and effectiveness of this public health initiative. Under Section 9.8.
Hold on, Commissioner Overman. As you all know, when we make changes to this order, we have to do it line by line of what you're doing. That's going to take everything in totality. So we're going to take each amendment by each member of this of this EPG by section that you're bringing forth. Okay, so you just made a motion. Are you making a motion to strike, have a period after thereof, and strike the language starting with nor shall? Is that what your motion is?
I'll restate the motion. I move that under Section 9C, strike the following language after thereof that says, nor shall any business operator or employee deny such person admittance or service because he or she is not wearing a face covering.
Is there a second to the motion? Is there a second to the motion? Is there a second to the motion? And this is the language that was recommended by Ms. Beck. Is there a second?
I'll second for a question. I'll second for a question.
Okay, there's a motion by Commissioner Overman, second by Commissioner Merman. Commissioner Merman, you have a question to the motion.
Thank you. And it'll depend on the answer to this, whether I support it or not. But okay, so I'm looking at the language in 9C right now. It says persons for whom a face covering would cause impairment due to an existing health condition. No business operator or employee shall ask a person not wearing a face covering pursuant to this exemption to identify a specific health condition or supply documentation, and then thereof. And you want to delete everything after thereof. Is that correct, Commissioner?
Correct.
Yes, that is correct. All the other sentences stay in place. The only thing it does is to allow the business operator to refuse service inside their business at that location. They can offer them services in any other way, but this allows them to say, I'm sorry, you're not wearing a mask, i.e., no shoes, no shirt, no mask, no service. And there are lots of businesses that have chosen to stay open that way. And by having that sentence there, it may preclude them the ability to remain open if they're unable to keep their employees safe.
Okay. I'm not going to be able to support that. And I'll tell you why. I mean, it's very simple. I think businesses, they're going to ask somebody, we need to give them some latitude here on what they can do and not do. And I don't want to put any more burden on them than we already have asked them, because this has been tough for them the last couple of weeks. But I just feel like allowing them to deny people's admittance, and they're struggling right now with jobs and trying to make ends meet. I feel like this, at this point, I like it the way it is in 9C, and I don't want to make any other changes.
So you withdrawing your second to the motion?
I am. Thank you.
Okay. There's a motion on the floor by Commissioner Overman. Is there a second? Is there a second to the motion? Is there a second? Motion dies for lack of a second.
No, Chief Castor, I'm sorry. Mayor Castor, I second. I'm sorry I couldn't get my mute off. Regardless if there's going to be support for this or not, others can still refuse someone, allow them.
Exactly.
Business. So I agree with it, Commissioner Overman. I would support it, but even if it isn't taken out, business can still deny someone coming into their business.
Okay. Ms. Snively, you recognize.
Thank you, Mr. Chair. I would be concerned that this could be discriminatory to those who may have a disability. No shoes, no shirt, no service is a lot different than having a medical disability and telling a person or requiring them to leave the business because of a disability. So I would not be able to support the removal of that as well. Thank you.
May I ask?
Hold on.
Okay.
Commissioner Merman, you recognize.
Oh, I've got to take my hand down. Sorry.
Okay. Commissioner Overman, you recognize.
May I ask Ms. Beck to address Ms. Snively's concerns?
Yes, Mr. Chair, if I might.
Yes, ma'am.
This would not prohibit a business owner from allowing takeout or delivery. I think there's flexibility. It's really just designed to allow if it's removed, it would simply allow the business operator to have more latitude in making decisions for the business. And I don't know if Jenny Tarr is on the line, if you want to add anything to that, Jenny, if I left anything out.
Ms. Tarr, you recognize.
Oh, thank you, Commissioner. Christine, I think you covered the issue perfectly, and that's exactly what the law would provide.
Okay. We have a motion to amend from Commissioner Overman, second by Mayor Castor. Seeing no further discussion on the amendment to the motion, to the amendment to the ordinance, please call the roll.
Miller?
Yes.
Overman?
Yes.
Merman?
No.
Cronister?
No.
Castor?
Yes.
Ross?
No.
Lott?
No.
Snively?
No.
Motion failed, 3-5. Merman, Cronister, Ross, Lott, and Snively voted no.
Commissioner Overman, you recognize.
Thank you, sir. Thank you, Chair. The second area that I'd like to consider changing is under section 9H. That change, it would read persons eating and drinking while seated. The guidelines have been basically for restaurants and other establishments to be able to eat and drink without masks on. But it also, in order to maintain social distancing guidelines that are in establishments, had recommended while seated. Our document doesn't include that, so the only change I would recommend at this point would be under section 9H, change the language to now read persons eating and drinking while seated. And that's my motion.
So you're gonna have it will read persons eating or drinking and take out the semicolon and say while seating and then have a semicolon?
My copy didn't have while seated. So if it's
I know that, but I'm reading to you I'm trying to get back to you what you want to have on there. It will read, your motion would be persons eating or drinking while seated.
Semicolon.
And, okay, all right. There's a motion by Commissioner Overman. Is there a second? Is there a second? Is there a second?
I have a question. I'll second.
Motion by Commissioner Overman, second by Commissioner Merman. Commissioner Merman, you have a question.
Sorry. Okay. So a lot of restaurants have like stand-up tables that don't have chairs at them that people eat at and drink. So I don't know how you can change it to accommodate for that. I think it's just each particular restaurant has their own little peculiar layout and furniture the way they want it, especially restaurants that have bars. Remember, now you can, the bars that have over 50% food can be open. So how do we accommodate for that? Christine Beck.
Ms. Beck, you recognize.
Yes, Commissioner Merman, I think what Commissioner Overman is getting at is the Department of Business and Professional Regulations most recent order required patrons to be seated while being served in a restaurant. Most of the orders just say while eating and drinking. I have not seen another order that actually includes the while seated, but it is a legal option.
So Commissioner Overman, I completely understand.
Commissioner Merman.
Sorry. I just wanted to, I'm not going to be able to
Go ahead.
support that. I'm not going to be able to support it. I like it the way it is. Thank you. So
Commissioner Merman withdraws her second. Is there a second to the motion? Is there a second to the motion? Is there a second to the motion? Motion dies for lack of a second. Commissioner Overman, you recognize.
Thank you, Chair. I'll try one more time. Under section 9I, I make a motion to change the language to read, children under the age of 18 participating in private, public, or nonprofit organized youth activities, including youth sport teams and leagues, youth clubs and programs, childcare, summer camps, and youth recreation camps, provided that all activities are adhering to CDC and Hillsborough County guidelines, in addition to any applicable federal, state, and local regulations. And that's the end of the modification. I'd like to follow up with one item. Is we spent several weeks coming together with guidelines for these organizations to operate. We don't make reference to it in this language. And just to be clear, it still holds those organizations to the guidelines that are recommended by the CDC and Hillsborough County. And so that's why I wanted to have it added to the language. Those rules still exist, but it just makes sure that it's very clear.
Is there a second to the motion? Is there a second to the motion?
This is Mayor Castor. I'd just like to, not necessarily, but point out to Commissioner Overman that if she looks at paragraph 6, would that satisfy what you're saying?
Yeah. Paragraph 6. Paragraph 6.
Oh, I'm sorry, not that one. That's the I'm sorry, that's mask, like in a Chapter 876, it says you can't wear a mask. It is stated somewhere in here that the CDC guidelines is it not, Ms. Beck?
Oh, it's under the whereas.
Yeah, I'm sorry. But anyway, it just seems maybe redundant. Ms. Beck may want to weigh in on it.
Ms. Beck, we got a motion on the floor. We didn't get to the second to it, but we'll go ahead and allow the conversation to get clarity. Ms. Beck, you want to comment on that?
Yes, I understood it. Just really to be clarification, I mean, the guidelines are what they are and people are expected to follow them. I think it's simply a request to add more clarification to that paragraph. However, I don't think it's necessary to achieve compliance with that.
Well, if it's not necessary, I'll withdraw the motion. I just wanted to make sure that we do want to encourage those organizations to follow Hillsborough County's guidelines that we established through weeks of discussing how those operators can operate safely in our county. And I did not want to be recorded.
Commissioner Overman, I think where it is, if you go to page 1 and the last whereas on the bottom of the page, says whereas even though the governor is providing a plan for reopening of businesses as well as recreation and other activities, individual and businesses have been advised to follow CDC, to follow Center of Disease Control and Prevention guidelines and to the bottom of the page.
I agree. However, Hillsborough County has some more stringent rules beyond what the governor's order suggests, and that's why I wanted it referenced. But it doesn't look like I'm going to get a second anyway, so I'll leave it.
I'll withdraw your motion. Okay, all right. Motion is withdrawn. Is there any other discussion on the executive order? Commissioner Merman, you recognize.
Thank you, Mr. Chair. I do really appreciate that. I'm going to try one more time to take Sheriff's Department in 12A out of that paragraph. And so my motion would be to take out the Hillsborough County Sheriff's Office and, of course, leave in the rest of the paragraph. That's my motion.
So you're taking out where it says the Hillsborough County Sheriff's Office at the beginning?
Yes. Mm-hmm.
So we'll start off as...
yeah, there's another spot too. I'm sorry, I forgot. Second sentence.
So where it would read is Hillsborough Code Enforcement Department are empowered to investigate any situation where a business/person is alleged to be violating the order. And then you would stop with delete the Hillsborough County Sheriff's Office on line 4 and start off with Hillsborough County Code Enforcement Department. Is that what you're doing?
Yes, please.
Okay.
Thank you.
There's a motion by Commissioner Merman. Is there a second? Is there a second? Is there a second? Motion dies for lack of a second. Is there any other amendments to the order? Any other amendments to the order? Any, Sheriff Cronster, you recognize?
Thank you, Mr. Chair. I have a question for Ms. Beck. We have a lot of concealed weapon permit holders in Hillsborough County, and part of their mandate and requirement is they're prohibited from wearing any type of face coverings. How will this order affect the all the weapons, concealed weapons holders that we have here in Hillsborough County?
Yes, Sheriff Cronster, I've had that question posed by others as well, and there's nothing about this order that would want to conflict with, I believe it's Chapter 790 of Florida statutes. We could add something to the order to clarify that, simply to make it clear that we're not in any way trying to create a conflict with Florida state law on that point, if that would be helpful.
Thank you, ma'am.
Okay. Commissioner Merman, you recognize.
I forgot to take my hand down.
Okay.
Remember.
Is there any other amendments to the executive order? Any other amendments to the executive order? Any other amendments? Mayor Ross, you recognize.
Thank you, Commissioner Miller. I was misinformed regarding concealed permit holders. I had been told that that section of Florida statute would not be applied to this. And now I just heard say that we would need to clarify that in the order. I was misinformed on that. Earlier or now, I'm not sure which. So go ahead, Christine, because I'll make a motion.
Mr. Miller, let me ask Paul Johnston. He's on the line. As you know, he's a former sheriff's deputy and represents this body for many years. So let me see if Paul can help clarify that particular concealed weapons question.
Okay.
Good afternoon, board members. I have not seen anything in 79006 concerning the concealed carry statute that prohibits the wearing of a face mask for health purposes. I'm not sure where maybe Sheriff Chronister can point me to where it is he's talking about in there.
I can send it to you, Minister Johnson. It's in there saying that part of their agreement is where they can carry and where they're not permitted to carry. It's also in there where they're prohibited from wearing any type of facial covering if they're going to conceal a weapon.
I would appreciate it if you would send that to me.
Okay, sir.
Yes, sir. I'd like to make a motion that we direct the county attorney to include a paragraph or a section in this order stating that intent of this order to, well, I need help with the language, Christine. I'm trying to make we don't impede the civil or concealed weapons permit holders.
Yes, I understand the concerns, and I think we could easily add something to the order, specifically with regard to Chapter 790, to make it clear that this order is not intending to in any way alter any rights of concealed carry permit holders or to be in conflict with that statute. And then after we've seen the language that's being referenced, if there's anything more we would need to do, we could always bring that back to the body for further direction.
Okay, and so how would that get incorporated today?
I think if you just make a motion directing us to add a paragraph clarifying that this order is not intended to in any way conflict with Chapter 790 of Florida statutes and concealed carry weapon permit holders, we could add that.
Okay, Mr. Chair, I make a motion containing the language just described by Ms. Beck.
I'll second.
There's a motion by Mayor Ross, second by Commissioner Merman. Let me ask a question here. So if we pass this, if a person goes into a business and they don't wear a mask and the owners of that business ask them to wear a mask and they say, I have a concealed weapons permit, I should not wear a mask, that will go?
Are you asking me?
Ms. Beck, I'll defer to you. That's not what I understood you to just say, but can you clarify?
Chair Miller, I don't believe the order is in conflict, but all I was suggesting is that we would make it very clear that we're not intending to be in conflict with Chapter 790. I don't think it is in conflict, but we can review that and make it clear to anybody reading the order that 790 would control if there is a conflict.
Okay. Mayor Castor, you recognize.
Thank you, Chair. Why don't we check with the state? I can't imagine that this hasn't come up before. I'm with you, Chair Miller. It sounds like someone could just say, I have a concealed weapons permit and therefore don't have to wear the mask. I'm sure we're not the ones that have dealt with this on the state level. That's a comment and a question.
Commissioner Overman, you recognize.
Thank you. I hear the concern, and I do respect those that have concealed weapons permits, but aren't they required to carry them on them, and they should be able to show it and have it be a non-issue? That's the whole idea of a permit, right? Unlike the other issues associated with disability or health crisis or health circumstances that is under protected information under HIPAA, a concealed weapon permit isn't offered protection under HIPAA. So if it doesn't preclude someone that is allowed to carry a weapon, I'm not sure it's necessary, but if it does permit a business owner to accept the reason for not wearing a mask because someone has a concealed weapons permit, then all they have to do is show the permit, right? Is that how that would work?
Who wants to answer that?
This is Mayor Pastor. I'll dive in with this. I think the point that we're trying to get to here is that individuals should wear a mask and capable of doing so or have a disability, not to include individuals who have a concealed weapons permit in the mask wearing category. Or am I out on an island here?
Mayor Castor, this is Christine. I think you're correct. I don't know of any other order that has any, and I've looked at dozens, if not more than that, relating to face covering orders, and there's not typically a reference to that body of law. So I'm thinking that there isn't a concern there, but there wouldn't. I think right now what the struggle is that we're not aware of a section of Chapter 790 that says that concealed weapon permit holders can't wear masks. So that may be something we just have to do a little more research on. But for now, I was hoping that it would be sufficient to simply say that we are not intending to be in conflict with that aspect of state law.
Mayor Ross, you recognize.
Thank you, Chair Miller. So I would like to amend the motion to contain everything I said before that Christine outlined about we don't intend to conflict with Chapter 790, but incorporate Mayor Castor's suggestion, which I think was a good one. And in the motion, we could direct the county attorney's office to do further research and bring it back to us Monday to put this matter to rest. And at that point, we could either remove that section, which would only be in place for a week, or we could modify it, whatever we need to do as a result. But this, for the next 7 days, I think would signal our clear intent that it's not our intent to interfere with the rights of concealed weapons permit holders.
Okay, there's Ross is amending his motion. Is there a second to his amendment?
I'll second.
There's a second to amendment by Commissioner Merman. Is there any discussion on the amendment that Mayor Ross made to the motion? Any discussion on the amendment? Well, Mayor Castor, you recognize.
Sorry, I forgot to pull the hand down.
Okay. All right. Any discussion on the amendment to the motion? Seeing none. Call the roll on the amendment to the motion.
Miller?
No.
Overman?
No.
Merman?
Yes.
Cronister?
Yes.
Castor?
No.
Ross?
Yes.
Lott?
Yes.
Snively?
Yes.
Motion carried 5-3. Miller, Overman, and Castor voted no.
Okay, we're now back on the amended motion by Mayor Ross, second by Commissioner Merman. Is there any further discussion on the amended motion? Any further discussion on the amended motion? Any further discussion on the amended motion? Please call the roll on the motion.
Miller?
No.
Overman?
No.
Merman?
Yes.
Cronister?
Yes.
Castor?
No. No.
Ross?
Yes.
Lott,
Yes.
Snively.
Yes.
Motion carried 5-3. Miller, Overman, and Castor voted no.
Okay. Are there any other amendments to the executive order? Any other amendments to the executive order? Any other amendments to the executive order? I have a motion to approve the executive order.
So moved.
Motion by Commissioner Overman, second by Commissioner Merman. That last amendment gave me some real consternation. Seriously, I thought we had a decent agreement on the executive order, and then we added that to it without getting any clarification before we added it. That really gave me some consternation. Call the motion on the amendment, on the order. I'm sorry.
Miller,
Yes.
Overman,
Yes.
Merman,
Yes.
Cronister,
No.
Castor,
Yes.
Ross,
Yes.
Lott,
No.
Snively.
No.
Motion carried 5-3. Cronister, Lott, and Snively voted no.
Okay. Anything else, Ms. Beck?
No, sir.
Okay. Thank you very much. Is there anything else we need to discuss today from the EPG members? Ms. Snively, you recognize.
Thank you, Mr. Chair. I just wanted to address one of the public comments, if you'll allow me, with regard to the school district and some of the decisions that are being made. And since they impact so many families in our county, I hope you'll allow me to take a moment to address that, sir.
You recognize.
Thank you, sir. So the part of the comment, I think, was a parent who had concerns about the reopening of school in August. And there are many parents and faculty members who have concerns about the Model A, which is assuming that the plan would be Plan A, the traditional plan, giving our families three different options, one option being returning to the classroom as in a traditional sense, the second option being doing distance learning like they did the last 9 weeks, like we did the last 9 weeks of school, or choosing virtual school, Hillsborough virtual school, or Florida virtual school. And so I just wanted to address the EPG members as you are possibly getting questions about this, and just put out some good information, hopefully, to the public today. And just to reassure this group that the superintendent has developed 3 different plans for reopening schools, depending on the various COVID scenarios that could exist. We don't know exactly what's going to happen with the COVID cases and what the governor and the Department of Education could decide. So all of that could possibly impact the decisions. But I wanted to let this group know that the school board and the superintendent are listening to parents and staff concerns. The school district has developed a 7-page frequently asked question document that's available on the Hillsborough County Public School website on the school reopening page. So there's a whole page dedicated to reopening information and hopefully answers many questions. The superintendent met this morning with the Hillsborough County Classroom Teacher Association to hear their concerns and answer some of their questions. And also, as mentioned in public comment, there was a request for a town hall type of interactive way that parents and faculty can ask questions. And so the superintendent is planning to hold virtual public forums for he and the board to participate so that parents and teachers can ask questions and interact and get answers about their options. We're trying very diligently to get information out, but we're also trying to collect information to figure out what parents feel comfortable with, which plan they would like to choose, because obviously we have staffing concerns. The superintendent has to staff all of the school locations and being the largest employer in the county, trying to get a handle on how many staff are going to be required to be back in the classrooms or to be teaching virtually. He does have a plan to extend the declaration of intent survey that went out to parents until he can establish more information and get more information to parents publicly and virtually and interactively. So that looks like the survey is going to be extended until the 17th of July. That's July 17th, in order to collect more information and get more information out, answer more questions to address parents' concerns and faculty concerns. So just want to reassure you that the superintendent is working very diligently to get that information out and address those concerns. He did come into our school district right at the beginning of the pandemic. He's new to our district, the first superintendent in 50 years to be hired from outside of our school district. And so he is doing, in my opinion, as a school board member, he's doing a fantastic job trying to address the concerns and trying to listen to the concerns that parents have. So just to let everyone know, there are plans. It is a fluid situation. He's doing his best and trying to offer as many options as he can so that parents feel comfortable with whatever choice that they make to educate their student. And I'd be happy to answer any questions that you may have, or if you want additional information based on what you're hearing or what requests you're getting from constituents, I'm happy to bring that information back to this group. But thank you for allowing me the opportunity to speak to those items.
Yes, ma'am. Be ever mindful. I see some hands going up. We have no control over the school board. Understand that, okay? So let's not get carried away. Commissioner Overman, you recognize.
Thank you, Chair, for that reminder. Thank you, Ms. Snively, for your report. In the survey that's sent out, my kindergartner, or 2B, hasn't gotten the survey, and I just need to go on and apparently register him to the public school in order to find out what the plan looks like. But are you asking parents point blank, are you choosing to send your children to the other two choices versus going there because of a mandatory or not mandatory mask decision? Because the letters I'm getting from parents that are saying, please do something, although based on what we've just heard, the EPG is limited in its ability to mandate a mask for the largest employer in Hillsborough County, which seems strange today. But are you asking that question? Because I think you may find that if you've asked that straightforward question, you might get some really good data in how parents are making a decision.
Mr. Chair, may I respond?
Yes, ma'am. You recognize.
Okay, thank you, Commissioner Overman. Those are great points, and I do know that is a concern for a lot of parents about mandating masks. As previously stated, originally the superintendent has chosen not to mandate masks. He's still choosing not to mandate masks at this time. I don't know if that will be his final decision, as the situation remains fluid and could change, but he is addressing some of that and some of those concerns with the parents on the school website, and he will address that throughout his virtual sessions as well. That is a question that continues to come up about being concerned about whether or not we're going to mandate masks. At this time, he is not mandating masks, but I cannot speak for him to say that he will stay with that decision or change his decision. At the end of the day, it does come down to what decision he will make as the superintendent, as the operations leader for our school district. But I know that he is attempting to address the concerns about masks. It becomes very logistically challenging to mandate a mask during school, but there are workarounds that we can still comply with CDC guidelines. So I know that probably didn't answer your question specifically, so I apologize, but that is being discussed and considered, and I know that he's going to continue to try and push information out that makes parents feel better if there is not a mandate for masks in the school.
And I thank you for your response. I recognize it's difficult. My 5-year-old is learning to wear the mask, so just in case he needs to, and giving parents enough time to work with their children to learn how to adjust to the wet mask wearing is going to take some time. So the sooner that decision is made, one way or another, will help parents make a decision. Thank you for their work. I appreciate it. Thank you.
Commissioner Merwin, you recognize.
Thank you, and thank you, Ms. Snively. We're just getting flooded with emails, people wanting us to either do it or ask you to please mandate those masks. And we have no authority over the school system. I don't think we can say it enough right now, but I'm not going to ask you one way or the other, but I hope that you all will start to make statements that you are in charge of anything involving mask wearing, anything involving this virus, how it affects the kids in the classroom, everything, because we do not have that decision-making power. And so I just want people who are listening to understand that, so that they'll stop sending all the emails. So we love to hear from them, but we can't do anything with the mandating mask in schools. And that's all I want. I also sent some information to everybody, that face mask and COVID-19. It's an evidence review that was sent to me by a physician that I know, someone in public health. It's very, very good about the evidence on the effectivity of face mask in dealing with this virus. And it involves reviews from MIT, Stanford, University of North Carolina, Pennsylvania, on and on and on. So I know our comments have been so opposed to masks, and I understand that. And we rely on data to make these decisions. And the data right now is very compelling that we have to do something to control this virus. I'm not saying I'm going to stay with it forever, because when the numbers start to go down and I feel that people are safe, but I just think it's important that people understand this is a tough position. We have to balance economics, public health, all these different things out there, but we're doing the best we can. So thank you, Mr. Chair.
Is there any other discussions we have to have today? Anything else? Anything else? So our next meeting is scheduled for this Thursday at 1:30. And seeing no further discussion, we are adjourned. Have a good rest of the week.
Have a good day.